Hello everyone, I'm Dr. Ansu and Matthew and I am a registered pharmacist. So, with regard to the National Women's Health Week, which is observed between May 10 to 16, I would like to create an awareness regarding certain conditions pertaining to women's health. So in my previous video, I had already shared some information regarding HPV, that is the human papilloma virus related cervical cancer. Today, I would like to share few information regarding breast cancer. So first let us discuss briefly regarding breast. What are these breast? The breast is the tissue overlying the chest muscles. The breast is made up of different tissues ranging from fatty tissue to very dense tissue. Within this tissue, there is a network of lobes. Each lobe is made up of tiny tube-like structures called lobules that contain milk glands. Tiny ducts connect the glands, lobules, and lobes, carrying milk from the lobes to the nipple. The nipple is located in the middle of the areola, which is the darker area that surrounds the nipple. Blood and lymph vessels also run throughout the breast. Blood nourishes the cells. The lymph system drains bodily waste products. The lymph vessels connect to lymph nodes, the tiny bean-shaped organ that help fight infection. So what is breast cancer? Cancer begins when healthy cells in the breast change and grow out of control, forming a mass or sheet of cells called a tumor. A tumor can be cancerous or benign. A cancerous tumor means it is malignant, meaning it can grow and spread to other parts of the body, whereas a benign tumor is a tumor that can grow but will not spread. Breast cancer spreads when the cancer grows into other parts of the body or when breast cancer cells move to other parts of the body through the lymph or the blood vessels, and this is called as the metastasis. So what are the types of breast cancer? Breast cancer can be invasive or non-invasive. So what is the meaning of this invasive and non-invasive? Invasive breast cancer means it is the cancer that spreads into surrounding tissues. And non-invasive breast cancer do not go beyond the milk ducts or lobules in the breast, that is, they are not going to spread to the surrounding tissues. Most breast cancers start in the ducts or lobes and are called as ductal carcinoma or lobular carcinoma. So what are the signs and symptoms of breast cancer? The majority of women with breast cancer do not have any signs or symptoms when diagnosed. So the general signs and symptoms are, first one is the lump. A lump that feels like a hard knot or a thickening in the breast or under the arm. It is also important to feel the same area in the other breast to make sure the change is not a part of the healthy breast tissue in that area. So the first sign is like feeling of like a hard lump. Second one is any kind of change in the size or shape of the breast. The next sign and symptom is nipple discharge that occurs suddenly and can be bloody, and it will occur only from one breast. The next one is physical changes such as the nipple turned inward or a sore in the nipple area, and also skin irritation or changes such as puckering, dimpling, scaliness, or there will be formation of new creases over the breast. Sometimes even there can be a feeling of warmth over the breast. It can be even be red, swollen breast with or without a rash, with dimpling resembling the skin of an orange. And there can be also pain in the breast, particularly breast pain that doesn't go away. Pain is not usually a symptom of breast cancer, but it should be reported to a doctor. Breast cancer is the second most cause of death from cancer in women after lung cancer. However, the number of women who have died of breast cancer has decreased by 40% from 1989 to 2007, thanks to the early detection and treatment improvements. So, what all factors may raise a woman's risk of developing breast cancer? A risk factor is anything that increases a person's chance of developing cancer. So the common risk factors include, first one is the age. The risk of developing breast cancer increases as women ages, with most cancers developing in women older than 50. The next factor is personal history of breast cancer. A woman who has had breast cancer in one of her breasts has a higher risk of developing a new cancer in either breast. The next factor is the family history of breast cancer. Other factors include personal history of ovarian cancer, early menstruation and late menopause. That is, women who have begun menstruating before ages of 11 or 12 or went through menopause after 55 years have somewhat higher risk of breast cancer. Next is timing of pregnancy. That is, women who had their first pregnancy after 35 years or who had never had a full-term pregnancy have high risk of breast cancer. Pregnancy may help protect against breast cancer because it pushes breast cells into the final phase of maturation. The next one is use of hormone replacement therapy after menopause, use of oral contraceptives or birth control pills, race and ethnicity. White women are more likely to develop breast cancer than black women. The lifestyle factors include weight, as recent studies have shown that postmenopausal women who are overweight or obese have an increased risk of breast cancer. And also, decreased physical activity is associated with an increased risk of developing breast cancer and a higher risk of having cancer come back after treatment. And also, current research suggests that having more than 1 to 2 alcoholic drinks, including beer or wine, per day raises the risk of breast cancer. Next, let us discuss regarding the self-examination of breast. So, what are the steps involved in self-examination of breast? The first step is begin by looking at your breast in the mirror with your shoulders straight and your arms on your hips. So, what all things you should look for? You should check whether your breasts are of their usual size, shape, and color. And also check whether they are evenly shaped without any visible distortion or swelling. If you find any changes such as dimpling, bulging of the skin, like a nipple has changed its position or like it's an inverted nipple, or if you see any form of redness or soreness, rash or swelling, bring it to your doctor's attention. In step 2, you have to raise your arms and look for the same changes. Step 3. While you're at mirror, look for any signs of fluid coming out of one or both nipples. It could be watery, milky, or any form of yellow fluid or blood. The step 4 is feel your breasts while lying down. That is by using your right hand to feel your left breast and then your left hand to feel your right breast. Use a firm, smooth touch with the first few fingers of your hand, keeping the fingers flat and together. Use a circular motion about the size of a quarter. Cover the entire breast from top to bottom, side to side, from your collarbone to the top of your abdomen, and from your armpit to your cleavage. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer edge of your breast. Step 5 is Feel your breast while you are standing or sitting. Many women find that the easiest way to feel their breast is when their skin is wet and slippery. So they like to do this step in the shower. So cover your entire breast using the same hand movements described in step 4. So that's all regarding the steps involved in the self-examination of breast. As women are constantly juggling and multitasking to ensure a balance between work and home. They also have a huge to-do list which invariably includes every other than the regular health checkup. Women are predisposed to a number of health conditions as they grow older. So, regular screening is very important as regular screening ensures that any health issues are identified early. It is recommended that every woman should undergo regular breast cancer screening. As the risk of breast cancer increases with age, every lady above the age of 40 should have an annual mammogram done. And mammogram is a specialized X-ray of the breast tissue and is usually a digital one. This is usually recommended above the age of 40 years or if you have a family history of breast cancer, and it is advised to be done once every 2 years. And also learn self-examination of breast. A complete breast self-examination should be done every month along with an yearly examination by an expert. The earlier is this dreaded disease discovered, the higher are the chances of recovery. So this is a brief awareness on breast cancer. Thank you for listening.